My name is Peggy Clark. I'm with the Aspen Institute, and thank you for joining us today for this special conversation on artificial intelligence in global health, defining a collective path forward. And we're delighted to join with USAID's Center for Innovation and Impact, Bill and Melinda Gates Foundation, and the Rockefeller Foundation to explore some of these key leading new initiatives and interventions in AI and global health. We are delighted to say that we've partnered for a number of years with the Center for Innovation and Impact at USAID, particularly on our very own AMP Health program, Aspen Management Partnership for Health. And we're grateful for CII's really innovative spirit and risk-taking, particularly in the area of global health. We need it more than ever. And this particular work on AMP Health has been focusing on what is often a very weak link in global health, which is the capacity of ministries of health to innovate and to implement ideas such as AI for global health. And this particularly works in 5 countries in Africa, supporting leadership and management capacity to scale up systems. And I want to give a shout out to Robert Newman. Robert, are you here? There's Robert. And Jordan Morrissey. Jordan, are you here? Could you stand up? If anyone wants to learn more about this great partnership with CII. CII, we are so lucky within USAID for Center for Innovation and Impact. We have the founding chair, Wendy Taylor, who is going to be our moderator today, and then the second head of CII, Dave Milestone, who's right behind me, and then we have the incoming new director, Neillan, who is right there. And let me tell you that this is some of the most important work that's happening in global health that's come out of the Center for Innovation and Impact. And I'm delighted to introduce Dave Milestone, who's going to lead us off on our conversation today. But just simply to say that Dave is one of those people, as is Wendy and as is Amy, where rather than seeing obstacles and barriers, he really sees possibilities. So whether you're standing in the line for hot dogs at Aspen Ideas Health, and he's pitching an idea about a social impact bond for cholera, or a new suit for addressing Ebola, he really sees possibilities. And so that's what we're all here to talk about today. We have some of the most innovative thinkers on this issue. It's rare that we get such a wonderful group together like this. Our colleagues and partners have asked us to think about a collective path forward. So we have significant time for questions and answers. I think there are a lot of implications of AI in global health, and it would be lovely if we could tap into the wisdom of the room to help us think together about how we move forward on this. Let me introduce Dave Milestone. Dave is a dear friend. We've done a lot of great, important work together, and will continue to do so. He had, after a long career in the private sector working on product development, he came to join Wendy at the Center for Innovation and Impact and has done so much incredible work. So Dave, it's a pleasure to co-host this with you. We will co-host anything you ever ask us to do at Aspen, and we're delighted to welcome you all here today. Welcome.
Health, empowering frontline health workers and patients, or enabling countries to move towards value-based care health systems, the potential of AI to disrupt our work is huge. And of course, beyond the hype lie many challenges. But what this report highlights is that we as donors have an opportunity to come together earlier to address these challenges in a coordinated and effective way. However, past is often prologue, and sadly, the global health community and governments are traditionally late adopters of new technologies and approaches. I have a sign in my office that says, if nothing changes, nothing changes. So I'll ask us here today, what's going to change this time around with AI in global health? Will we once again be late to the party? Well, this report is just a report. It's a good one, I must say. It represents at least a step in the right direction. It highlights potential coordinated investments and action that can accelerate progress. We need a vision that is aspirational yet practical, holds ourselves accountable, and is grounded in and informs the much larger and broader digital health work that's been going on for decades. So from supporting the most promising and cost-effective solutions, to building government capacity, to developing evidence standards, and much, much more, there's no shortage of work to be done. And that's why I'm eager to hear more from this panel, who represent thought leaders and doers in AI. They bring to this discussion a variety of perspectives on how we harness the hype while attending to barriers with purpose, avoiding unintended consequences, and moving towards impact on the ground together and faster. And with that, I'm so proud to introduce you to our own amazing Rachel Fowler, who was essential in bringing this report together. She's going to give us some highlights of this work and most importantly set the stage for this important discussion. Thanks.
Hi everyone and welcome. It's great to see this turnout for this event. I know we hear a lot of hype about AI and we also recognize all of its risks and challenges, so it's great to have us all here. And that was the premise behind this report, to further explore what is the actual potential of AI and how can we be smart and strategic in exploring what is our role in investing in it. So I know Dave touched upon this a little bit, but we want to recognize that we as a development community, we tend to be a little bit later when it comes to adopting emerging technologies. And this graph is more so to be illustrative to show that as technologies have been emerging over the past few decades, how can we be more proactive in exploring them, potentially adopting them, and helping them become more appropriate for the global health context. And that was the premise behind this thinking for this report, specifically looking at AI. We've been hearing a lot. We want to know what is the role that we can play. So we partnered with the Gates Foundation as well as the Rockefeller Foundation. And in coordination with Boston Consulting, we came out with this report that essentially looked at what are all the different use cases out there in healthcare right now for AI. And based on that, which ones are suitable for the global health context. Either they're already implemented or they have the potential. Then based on that, what are the different challenges and risks that we see happening if we invest in them further and try to implement them and scale them in global health? And finally, we wrapped up the report with what are potential investment areas that we can look into and explore more so that we can be coordinated as we try to accelerate the appropriate use of AI in global health. So very briefly, I won't spend too much time on this slide because I know it's a lot of information, but it's essentially to show you that this assessment was very in-depth and looked at over 240 different examples of use cases in AI to understand what all is actually out there. Then we distilled it down to 27 different use cases and grouped them based on what we saw as high potential impact as well as feasibility in low and middle income countries. So we asked ourselves, to what extent do these use cases increase access or efficiency or quality in health systems, as well as in terms of feasibility? What is the actual maturity of the AI technology now? And what activity is happening with these tools in LMICs today versus would they have potential to be used eventually in the next several years? So we came up with these 4 buckets to group these prioritized use cases. And they are AI-enabled population health, frontline health worker virtual health assistant, physician clinical decision support, and patient virtual health assistant. And this helped us structure our thinking to then explore what are the different challenges within each of these use cases if we were to pursue investments. Next in the report, we lay out illustrative vignettes of each of these use cases to give you an idea of what we mean and how we define them, as well as to show you what is our future aspiration for these use cases. We recognize there are a lot of factors at play in order to have the successful implementation of these tools, but we wanted to show what the actual potential impact is in the next several years for these different use cases to show that there can be impact and it is worth us exploring. For instance, for AI-enabled population health, we talk about how in the future we hope that we can use that type of tool in order to take in real-time health data in order to predict health disease outbreaks. Then, of course, an important part of this report is really delving into the different challenges. And I want to recognize we did several.
Thank you so much, Rachel and Peggy and Dave, and thanks to all of you for coming. First of all, it's great to spend time with some of my most favorite people on the planet, and it was quite fun working on this report. But also, it was I think kind of exciting and also surprising to see the response we had to this panel. I think the event sold out in a couple of hours. It was clearly this AI is all about thought-provoking conversation. So they're all instructed that we're going to talk in sharp, make sharp points and move the conversation along, and I'm going to try to help with that. But I'm going to just move down the line here, and if you could just very briefly introduce yourself in 30 seconds or so, and then we'll jump in.
Hey everyone, I'm Jay Comernani from the Human Diagnosis Project. Our goal is to help build society's open medical intelligence system, and we view open intelligence as the third form of open knowledge. First was open code that helped build the internet, HTTP, SMTP, SMS, the protocols we use every day, as well as operating systems like Linux. The second phase was open content like Wikipedia, as well as open data projects. The third is really open intelligence, and more than ever, it's incredibly important that we have AI systems which are accessible, scrutable, and available to all.
Hi everyone, I'm Saurabh Jory. I'm the Chief Scientist at Avalon Health. Some of you will know Avalon Health, but we're also known as Babel in Rwanda. Our mission is to provide affordable and accessible healthcare to everybody on Earth. I myself am a practitioner of artificial intelligence, have been applying methods from machine learning and AI in population health, particularly infectious disease epidemiology. Been with Babel for 3 years and really excited about this panel.
Thanks. My name is Sunil Wadhwani. I'm what you might call a technology entrepreneur. Studied at Carnegie Mellon, grew up in India. Since graduation, I've started several different companies. My first company was a medical device company, which did not survive, which failed, but learned a lot of lessons. Those came in handy with my second company, which was an information technology services company. We grew to over 34,000 employees, and that company got sold a couple of years ago. So through that, I learned some of the challenges of scaling, what works, what doesn't work. I started applying this in the nonprofit world 5 years ago. I started a healthcare foundation in India. And the key was how to use technology and innovation to transform primary healthcare. So we are running 300 health clinics in the worst parts of India. Last year, we treated over 5 million people with free healthcare. It's growing very quickly. That number will probably double in the next 2 or 3 years. And then a year ago, my brother and I started an Artificial Intelligence Institute, also in India. And the idea was how to apply AI for social development. Because although there's isolated people around the world, applying AI for healthcare, education, etc., to help the bottom 2 billion people in the world, there's no critical mass of people anywhere. So we now in Mumbai have about 25 really high-class AI researchers, PhDs from places like Stanford, MIT, and so on. We're hoping to double that in the next year. And the CEO of the institute is right here, Dr. Anandan. He set up Microsoft Research Labs in India.
Thank you. Hi everyone, my name is Adele Wagaman. I'm with USAID in the Global Health Bureau, where I sit at the Center for Accelerating Innovation and Impact with Dave Milestone, Rachel Fowler, and others. And in my role, I'm looking primarily at how we can take and harness the lessons that we've learned in the digital health space over the past decade plus and apply that directly to the work that we do. We're working on a digital health vision for the agency, which will be the first time that we have guidance for these investments that we're making in country health systems. And we're looking forward to this conversation and look forward to taking this forward. Thank you.
Hi everyone, my name is Mark Peterson. I'm with the Bill and Melinda Gates Foundation. And there I lead the Data Technologies Initiative, which is focused on sourcing, testing, scaling up innovative technologies around data for development. Prior to joining the foundation, I've either led or been part of innovation teams in the private sector and with 3 different funders. So I will be bringing the excited yet skeptical eye of the funder to the conversation.
Okay, well, so now you all see we have a star-studded panel here, and so I think we're going to now dive into the discussion. So let's start with optimism. So I want to spend a little bit of time hearing from all of you and talk a little bit about the promise of AI and where we think it applies to global health. And maybe to Jay, to start with you, I'm going to start with our 2 innovators who are already on the cutting edge and developing some innovative solutions. So can you talk a little bit more about we'll start with you, we'll talk a little bit more about the Human Diagnosis Project and also where you see its potential application in global health down the road.
Yeah, sure. I wanted to start with 2 comments though. One was that I think optimism is important and it's always valuable for helping implement and craft new technologies, but we really need to avoid technology solutionism, the perspective that a specific type of technology can solve specific type of problems instead of focusing on the problems first and seeing if AI is applicable in those situations. In particular, I would say that we are very far from artificial general intelligence, and if I look at some of the clustered areas in this report, I think they're super exciting, and I'm very passionate about them as well. I just think that some of them are very far away, and I think some of the work that Sunil is doing in terms of specific applications of AI in specific contexts to create real impact now, I think are really compelling. I also think that using AI technologies in non-obvious ways to accomplish interesting goals, and that's one of the ones I'm going to talk about at the Human Diagnosis Project, is really the way to unlock the potential of AI in global health. So what we do is we built a system that now 20,000 physicians and other medical professionals from about 80 countries have contributed to building from around the world. As they create and solve clinical cases, we're using AI-based techniques like natural language processing, text prediction, medical ontologies to structure, encode, organize, and analyze that information into scalable medical intelligence. But what's really powerful as physicians are solving these cases, we're developing the first quantitative measure of clinical reasoning. And we actually published with Johns Hopkins in JAMA Open in January. And excitingly, this is kind of the first quantitative scalable way to develop longitudinal point estimates of clinical reasoning. This is profoundly important in developing the knowledge of health workers worldwide, because today we have no clue what different health workers around the world know and don't know. And the first thing we need to do before we add decision support, before we actually try to train new health workers, before we try to improve remote clinical decision making is just know what people know.
Well, why don't we move on to you, and I'd like you to explain a little bit about Avalon. Your innovation is focused more on a direct to patients, but you have the potential to get into some of that decision support. You also have an innovation that started in the UK, and you're transferring over to Rwanda. So I want to also talk a little bit about making that leap as well.
Sure. So Avalon is based in London, around 1,200 staff, all in all. We're also based in Rwanda, as Wendy mentioned. We are an organization which is a handful of really talented scientists, research engineers, but it's not just the scientists and engineers, it's those scientists and engineers working together with doctors, with epidemiologists, with public health professionals to build these solutions. And so these solutions are, as Wendy mentioned, the system which is direct to the hands of the patient or the consumer, but also taking that same set of underlying technologies to enhance clinical decision making for physicians and then potentially for frontline healthcare workers. So we're in the UK, we're in Rwanda, and very soon we'll be operating in 12 countries in Southeast Asia. In fact, as of yesterday, we rolled out our technology in Malaysia. So we're getting a lot of experience of localizing and adapting our AI across the globe. Really what we are focusing on is really three areas. One, the kind of patient experience through the chatbot services. We have virtual health services, so this is traditional telemedicine. But as I mentioned, also the clinical decision support. So the artificial intelligence which we've developed can be almost as if it's a module which can plug into each of those different services. So in Rwanda, historically, we've been focused very much on the telemedicine approaches. But in the last 6 to 8 months, in partnership with the Gates Foundation and our colleagues in Rwanda, we've been trialing a kind of study where we've been looking at the impact of our AI in terms of it supporting frontline healthcare workers. And in the last 3 months, we've supported over 10,000 consultations through the AI. And we've been getting some really encouraging reports from patients and also the nurses and other healthcare workers on the front line who have been using these technologies. Really encouraging in terms of actually how in-depth the consultations are and actually how impactful they've been on reducing some of the burden which we see in the healthcare system.
So is it safe to say that you disagree with Jay and that you're already out there doing this, so you don't...
We're out there doing this, and we're doing this rapidly. And so we're seeing some of these hurdles, but we're overcoming some of these hurdles, and I guess we'll talk about that in the next section.
All right, good. Well, we can come back to some more of that. But Sunil, let me bring you into the conversation. You've started this institute. You see lots of potential for AI. So can you talk a little bit about what drove you to take this big step, and both you can talk a little bit about some of the things you're already investing in and also where you see the real promise.
Sure. So the premise for setting up the institute, as I mentioned, was I was chatting with my brother about a year ago. He's also a technology entrepreneur based in Silicon Valley. And we're both very familiar with what's happening in the AI world. And to us, it was surprising that although there's been a lot of talk about applying AI for social development, there are relatively few people actually doing it, and there's no single place anywhere in the world where there's a critical mass of researchers working on this. So we said jointly, why don't we set this up? And we set this up about a year ago in India. We're very fortunate that Dr. Anand came on as a CEO. Prime Minister of India came down to inaugurate this, which was a great honor. So we have, like I said, about 25 researchers right now, and we're operating at different levels. So number one, we're developing on-the-ground solutions using AI to address real issues. So one big area of focus for us is tuberculosis. It's the biggest infectious disease killer in the world today. 10 million people every year get TB, close to 2 million people every year die of tuberculosis, more than HIV and malaria combined. So we're applying AI in 3 or 4 different areas for tuberculosis. One is, there's a form of tuberculosis called MDR TB, multiple drug-resistant TB, that is really exploding around the world. So we are using AI to help identify patients who are likely to fall off their medication regimen, because these are the folks who become multiple drug-resistant TB cases. We're working on other use cases within TB itself. Frontline health is another area. So infant mortality, maternal mortality is still unfortunately extremely high in many low-income countries around the world, and especially in poor rural areas as well as urban slums. And a lot of this infant and maternal mortality comes from high-risk pregnancies. But the problem is, in these low-resource settings, health workers who are poorly trained, etc., aren't able to identify mothers with high-risk pregnancies early enough that you can make effective interventions. So we are using AI to come up with methods of doing that. Third area that we're focusing on, all of these, by the way, all of these use cases we didn't come up with ourselves. We had major discussions with the government, with people like Gates Foundation, with USAID, etc., coming up with this. In agriculture, as an example, India, right, 1.3 billion people, cotton is one of the biggest agricultural crops. Last year, 40% of the cotton crop was wiped out because of one pest, one bug. And the problem is they don't have methods for detecting these bugs, how do you treat them, etc. So because of this huge loss in all of these countries of crops to pests, that then means farmers are unable to repay the loans that they've taken at very high interest rates, and hence farmer suicides happen in the tens of thousands every year around the world. So we're using AI to help detect these pests earlier, help advise farmers on what preventive measures to use, what corrective measures to use, and so on. So that's one level we're working at, which is actually developing solutions. And many of these will be going into field experimentation in the next 3-4 months. Beyond that, we are working at a government level to help develop standards for data capture, standards for data dissemination, which is really important, as Rachel was saying earlier and Wendy, in terms of how do you build the ecosystem for AI in global health. And finally, at an international level, we're working with the World Health Organization and helping them develop standards on how to apply machine learning for global health. And this will then form the basis for standards in countries around the world. So some examples of the things.
Yeah, give examples also of getting into the ecosystem building. Mark, let me just turn to you. We've got a number of examples on the table already in terms of different use cases. So the clinical decision support and even the work to better understand how doctors make decisions and what they know and don't know. We've got doctors in the pockets even for patients. Gates Foundation is always on the cutting edge of investing in innovation, and I know some thoughts on capturing the promise of AI and really being able to understand the end users. So can you bring in some of the insights around digital health that are important here in terms of really understanding end users when we're designing these innovations?
Yeah, sure. Well, I think we're meant to be provocative, and I don't know that it is actually that provocative to say that technology alone is never going to be the silver bullet. It's never going to be the magic quick fix that solves all of our development and health and humanitarian challenges. And I think we see this exemplified with artificial intelligence, where we have great hope. There is increasing call for extending the quality and the access to and the equity of healthcare around the world. And in order to do that, we're going to need help, because we have huge structural and infrastructural constraints that are the reason why we can't do that today. And AI, unfortunately, is not on its own going to fix those things. But it does have great potential, and so it's exciting to have these kinds of conversations about where can we start, how can we move forward. And I think there is a real depth and breadth of lessons learned over the past decade plus from the field of digital health more broadly that we can apply. And to this particular question, I think a really important one is this question of how do we design with the user communities where the technologies, regardless of whether it's AI, ML, or something else, are going to be used. And drawing the rich insights that help inform what the problem is that we're trying to solve, and what are these structural and use environment constraints in which people are currently trying to address this problem. So that as we build and design and implement these tools, we are being reality-based, and it's wonderful to have these examples of where that's already being done so that we can learn from you all and think about how that applies more broadly. But if you look back across the field of digital health more broadly, you see time and again, you go to places and there are closets full of old technologies that literally have become a physical burial ground for old technologies that haven't worked, and it's because they weren't sufficiently ruggedized, there was not sufficient available technical capacity to do the maintenance needed on the software or the hardware to keep it going, and they just get abandoned. And so we need to be thinking not only about the very complex and detailed challenges of moving artificial intelligence forward for global health, but also how do we learn from the broader field of digital health in the process of doing so.
Yeah, no, that's great. And that was going to be my segue into the challenges discussion, but I just want to pick up on one piece that you mentioned, Mark, and Saurabh, go back to you. So you talked about how it's often challenging taking something that works in one setting and getting it to work in another. And Saurabh, maybe you could talk a little bit more about going from the UK to Rwanda, and then you're now expanding into many countries in, I think you said Southeast Asia. So what changes? What do you have to understand about those different markets? Do you need different data? Do you need, is it just completely portable, or do you need to really make some design adaptations when you're going into two new markets?
Yeah, so the key challenge for us is localization. So we've designed this AI for healthcare. We've put in a lot of effort into designing this AI for healthcare in the UK. That's actually, as we roll out across Southeast Asia, or as we go into Rwanda, the key thing for us to understand is actually the kind of disparity in healthcare burdens. So particularly risk factor burden and disease burden. So the way that we construct our models, to use a slightly kind of technical term, is rather than using these kind of deep learning approaches, which are kind of very black box, uninterpretable systems, we construct this other class of AI methods, which are driven both by data but also by experts. And here the experts can be doctors and epidemiologists. And the data which we use is actually data from large-scale partnerships with the likes of the Institute of Health Metrics in Seattle, who do these global studies to look at global disease burden. And so what we can do is essentially, if we just think about it, is just to swap out the pieces of data which relate to the incidence or prevalence of a disease in the UK, and adjust that to reflect the local disease burden in Rwanda, Southeast Asia. It's going beyond the actual model or the AI which thinks about the disease process. We also have to think about the kind of cultural sensitivities or the cultural aspects of actually how patients interact with our chatbot. It's kind of widely known that the concept of pain is different from country to country, and so we also have to reflect that in our the building of our natural language processing and natural language understanding engines as part of the overall AI that we build.
Thank you. So Adele, I'm going to go back to you, and we're going to shift the conversation to some of the challenges for AI. And you have spent a lot of time thinking about the a decade of learning from sourcing and scaling innovations in digital health technologies. And you're developing an investment guide for USAID and potentially for other donors. So, so can you talk a little bit more about some of the lessons learned that you think are particularly applicable here in the AI context?
Sure. So I'll start by giving just a brief synopsis of a bunch of things that have happened in the past year that to me signal that we are at an inflection point now in this space in which we have had enough time to be investing in proof of concept demonstrations and pilots and learning as we do this to now be thinking about how do we systematically apply those learnings and change the way we are making these investments and designing and rolling out these programs in consequence. So in the past year alone, we had for the first time, a U.S. government statement on digital health, articulating a kind of consensus view across all the different U.S. government agencies that fund digital systems to support low and middle income country health work about how best that should be done. We had the creation of a WHO digital health resolution. There had been e-health resolutions and related resolutions in the past. This was the first time we had a digital health resolution. We have the principles of donor alignment for digital health. This is a reflection across all the different donors of this best practice and these lessons, and how can we now translate that into something that we can operationalize as we take this work forward. And I think together with the signals is a new digital health agenda. Those were the words of the representative from the government of India when he announced the WHO Digital Health Resolution, that I think really does have the capacity to reshape the way we approach this work going forward, and hopefully in consequence enable us to see down the road health outcomes from these programs that are improved by this increased integration of best practice, increased alignment among donors in our activities in such a way that can help propel and advance this work going forward. And just to rattle off a couple of the key points here, one is around country ownership. In the USAID context, we talk a lot about the journey of countries' journey to self-reliance, and that ultimately we should be investing in programs that we think our country partners over time can themselves take on and reasonably sustain. And that's only possible when you have a coordinated approach to these technologies and their implementations. Very difficult to do this when you have 1,000 flowers bloom context of lots of different technologies, each trying to do their own specific specific work around a disease or health promotion area. And so we need to be better empowering countries to articulate what are their digital health plans, what are their health plans, how can digital, including AI, support them. We have now this new WHO digital health resolution that also speaks to AI and what WHO itself can be doing to support member states in this process. And we're continuing to see a lot of learning in this space overall. So for example, on April 17th, the World Health Organization will launch new digital health guidelines. This is the first time we have evidence associated with various digital health interventions to help make clear recommendations to countries about where they should be focusing their efforts. So I think it's a large and complex space. There's a lot to try to keep your eye on, but there is increasing centralization in where to focus efforts thanks to these efforts over the past year.
Yeah, I think those are certainly going to be very helpful for the field and to create some nice roadmaps. Maybe let's drive down into some of the details and talk more specifically about some of the challenges to scale. And I don't know whether either one of you want to start and lay out where you think some of the challenges are. Sunil, I know you've got a lot to say and have thought a lot about this and experienced some of the challenges trying to just introduce innovations in India. So who wants to dive in first?
Yeah, I'll
and
mention.
Let me just say, if you've got a question on the front row, I'm going to bring in questions, but you can be the first time.
Thanks. Thanks.
Yeah, so I think the point that Saurabh made earlier, I think, is an important one, which is really around knowledge representation, because you have so many different types of people this knowledge could affect, right? You have patients, you have basic skilled health workers, you have advanced medical professionals. That's just as complex in some ways, and sometimes more complex than translating between different languages. And so the power of having standardized approaches to terminologies, medical ontologies, et cetera, the ability to clean and organize information is extremely important, and it's even more important for complex, broader applications like the one that Avalon is pursuing, where you're kind of across the care continuum, you're kind of primary care for any type of clinical decision. I think there were interesting and important points made earlier, which is when you can focus on non-clinical problems, when you can focus on non-patient focused problems, when you can focus on narrow intelligence problems, you can benefit from the fact that the complexity of knowledge representation is lower, and you can also capture large amounts of training data in very narrow verticals that can be semi-structured or well-structured and that can be interpreted effectively from an AI context. And I think that one of the big challenges with building generalized approaches to clinical decision making as well as decision support is A, the standardization and organization of information, B, actually unlocking that information, C, the actual ability to compute and learn on that information in a distributed way in many situations where there's low internet connectivity. So all of those are very challenging problems. So in AI, you have kind of, and in global health AI, you have multiple classes of very large problems, right? So you have enabling technologies which need to be in place in order to enable AI. So you need things like federated learning to learn on distributed databases when information is not in one place. You need things like mesh networks and edge computing to deal with low internet connectivity. So you have this entire class of technical problems. You also have obviously regulatory and stakeholder challenges, which are enormous, and I think where USAID and other global stakeholders can play an enormous role in helping facilitate those problems. And then the third category is really social context and all of these other problems associated with customization, the fact that populations are different, the fact that they can be affected by different factors in different contexts. And so when you compare that even to challenging AI problems today, like driving a self-driving car, which, you know, in the early 2010s, everyone was saying, oh, by the end of the decade, everyone's going to have a self-driving car, right? And we're still far away from that. We're still maybe a decade plus away from that being at full-scale rollout in developed countries. So I think that I'm very excited about the potential of these, but these multiple challenges and the way they manifest together is actually making it very complex to think about implementing some of these more general solutions at scale.
Sounds pretty daunting, and maybe a great example of how we can start separating. And we have a huge opportunity to attract private investment into some of these AI solutions. And that requires viable business models that have some kind of potential return. Also in digital health, one of the big principles has been around this idea of open source solutions, which in some cases may make viable business models for private investments a little trickier. So can some of you want to take that on and talk a little bit about where you see the business model challenges in AI?
Well, I can kick it off and then turn it over to colleagues. But one of the trends we're seeing is increased interest across a number of different donors in open source solutions. Software global goods, and where we can identify software global goods that have been widely tested and proven and scaled, how can we collectively fund these in such a way that they are not dependent on the project lifecycle, that they have core funding that goes beyond the closure of one mechanism and the opening of a next, in a way that enables the staff to be retained and the code to be maintained, that supports the fact that these tools are now being used at scale in so many different places. And so I think that's one, is can we align behind some core technologies that are increasingly backed by evidence and are trusted and used. And the other is to think about creative models depending on who the audience is. So even within low and middle income country environments, you have urban centers where you tend to have a greater concentration of financial well-being, and rural areas where you have more impoverished communities. And so are there business models that can take an approach, a freemium-based approach, where you charge for some services and use that to subsidize others?
Yeah, that's a really good segue, because that's exactly how we think about it. In fact, a lot of the information that we do open currently, so we enable open search on our site. We actually have a free online medical education platform that now 20,000 medical professionals from 80 countries are participating in both using and building. And then in addition to that, we also kind of work very closely with research community, with Harvard, Hopkins, UCSF, MIT, Berkeley, in terms of giving them open data sets to actually work with to do additional research. And actually, we do exactly what you're saying in terms of the business model. So basically, on the professional side of our offering, which is medical professionals, we basically offer this free medical education platform. But then for additional features, we also charge for that. And we work directly with health systems. We're now working with Kaiser Permanente in the US to do that. And then using that as a model to show that that can then be taken to other environments. And then on the patient side of the offering today, we offer kind of free kind of search of kind of the information that's already been collected in our system. But then we're going to actually kind of empower physicians to use our community and AI to actually get second opinions through the system. So they're actually going to be able to look at a complex condition they have and then get opinions from multiple different physicians from around the world on that given issue. But to your kind of earlier point about the importance of business models, really, in order to have solutions which scale in high tech, and this is really some of the most complex technology, to be able to attract the best engineers, designers, and other people to those problems, you have to have solutions which can cross-subsidize success in the private sector in developed world countries, and then take that technology to developing world settings where they can then scale even more effectively. And I think Avalon has done one of the best jobs of that, proving it in a market like the UK, and now kind of being able to kind of begin to take that to other environments.
I'd say business models are above my pay grade. I'm not a finance guy, I'm a scientist. So what I would say is that the solutions we have developed are freely available to patients. This is for triage and diagnosis, which we provide in the UK. And as I've spoken about, it will be going elsewhere to Southeast Asia and then Rwanda and further into East Africa. But beyond that triage diagnostic component, we'll also be providing this predictive analytics suite of tools as well. We've also, importantly, we've kind of mentioned some of the challenges of low internet connectivity, cellular coverage. We've actually, this is a private audience, right? So I guess this is not being transmitted elsewhere, but we've actually also...
don't be so sure.
I know.
Wait to the live stream out there.
We've actually done some research internally to show actually how we can put those models onto the device without any internet connectivity or cellular coverage at all. Clearly there are some challenges there in terms of protecting the IP which we developed, but we see that as a really encouraging step as to how we can provide this technology to healthcare workers out in the field. And then the other kind of point to pick up upon is the research which we do, we publish, and so all of those methods which we've been innovating on, we've got a team of 55, also kind of most talented research scientists anywhere working on this problem. We encourage them to publish. That work is published in open source journals. It's available for everyone to read. But we also open source the underlying models in some cases, particularly for our natural language processing engines. That's all available on open source sites such as GitHub. So we're pushing this back out into the community so people can learn about our methods.
Great. So we're going to shift gears to our final segment, and we've gone from optimism to
Cautious optimism.
well, yes. So yes, cautious optimism, and then we've heard all of the challenges, daunting challenges. So and then I think we're going to shift back to optimism. We'll call it informed optimism, and this is where I think we have an opportunity to think about how do we, and this is the title of this report, how do we define a collective path forward? And so we've got a lot of donors, investors, stakeholders all interested in this space. So perhaps we could spend a little bit of time thinking about, first of all, opportunities for collaboration and where we could bring multiple stakeholders together to perhaps forge some of these collective paths forward. So who wants to jump in on where collaboration could play a role here and what that might actually look like?
I can kick us off. So I think this event is a good example of the kind of cross-sectoral, cross-disciplinary dialogue that's needed to enable this to move forward in a constructive way. You need the technologists, you need the development and global health sector experts, you need ideally the communities in which these technologies are being rolled out, all involved in the conversations to be asking the hard questions. I think we've just started to scrape the tip of the iceberg on some of these really thorny issues like data, Who owns the data ethics? How do we hold ourselves accountable? There is not currently a body that is going to hold all of our collective feet to the fire, and so how do we do that ourselves? And how do we support one another in that process? How can we learn from one another? And so to me, the most practical step forward, I think, is coming to some agreement around common use cases where this potential is clearly demonstrated, some of the major challenges that we need to be aware of. I know in digital health overall, privacy and security is a really big one, and I think that just magnifies in the context of artificial intelligence, where you have to be thinking about concerns about the data going in, so where you have poor and low quality data environment and AI solutions working in those environments. How do you ensure that the people whose data are excluded are not being left out and are not unfairly being biased as a result? Really, really tricky issues, and I welcome those thoughts about how we can collectively tackle that in a sustained way beyond the end of the conversation here today. Mark?
Everyone would likely agree that within the development community, we may not have all the best and brightest when it comes to AI versus the private sector, right? So a lot of the cutting edge tech is going to come from the private sector. A lot of the talent is going to be in the private sector, hopefully also shared with the public sector. But because of that, because there are different incentives between the private sector and donors, for example, being able to come together as a development community and speak with more of a common voice, I think, has tremendous benefits that we could get from it. So as one example, when I was with Orange, we ran these data for development challenges where we opened up call detail records, very rich data sets about where people are when they're making calls, when they're calling, things like this, to the development community and just ask, what can you do with this? Tremendous response to that, like quite a lot of potential here, obviously, for creating good from this data. And yet, after doing that a couple times, the flow of data was cut off because it didn't really work. There was no sustainable business model for Orange to keep providing that data. But lowering the energy barrier for asks like that by coming together with a common voice to the private sector, so that they're not bombarded with 1,000 different requests from 1,000 different actors who are trying to solve the same problem, is useful. So one quick example of how this could work. So the World Bank has recently started up an international data collaboratives initiative to streamline asks from the development banks to the private sector for these sorts of data sets. UAE, I believe, putting together a global data commons, again with an eye towards AI use cases in development. So these sorts of things where we can speak with a common voice, whether it's requests for data or whether it's norms and standards around data technologies or ethical standards, I think makes us able to interact with the private sector in a more effective, more streamlined way.
Excellent. And maybe I'll just add to that quickly, sorry, that in addition to thinking about how we can be collaborating across the global health sector, which is a very diverse space, we need to be thinking about how we work together across all development sectors. And that is really where I think we're going to see the power of being able to pool ideas in a way that attracts the private sector in a way that we haven't been able to from a very siloed lens in the past.
Great idea, but it's hard enough to coordinate even within global health because we have so many silos. When we start to bring in other sectors, it makes it that much more daunting, yes?
It does. I think fortunately now we have some actors who whose mission is dedicated to do that cross-sector collaboration, the Digital Impact Alliance and others. And I think more people now see the benefit in picking our heads up and looking across the sectors at where we can be learning from one another and how best to partner with governments in that effort.
There are always benefits to attacking problems head on, but there's also, I think, as spoken to by multiple of the panelists, benefits to focusing on problems more tangentially and really focusing on where can we make the highest impact and perhaps even avoid entire classes of problems by working together, right? So one example is focusing on non-clinical problems, right? So how can we use data, AI, machine learning in that context? Then you can avoid issues of privacy regulation, many of the other issues that end up hampering the ability for those solutions to ultimately come to scale. And then the second category, even within clinical, there's benefits across the stack, not just on the patient side, but really everywhere else in the stack. And I think that is also a place where a lot of those issues can be actually mitigated comparatively compared to attempting to touch the patient directly from day one. So I think actually where you focus, I think, is a big part of it. I think the second part is really when we think about bringing the social, public, and private sectors together to solve this complex problem for the world, and we're actually organized as a public-private partnership for that reason, the thing that you really need to think about is the unique skills and competencies that each of the sectors brings, right? So bringing the technology talent, the design talent, the user experience, all of these facets really needs to be driven by the private sector. And then really where the social and public sectors can play tremendous roles is around both funding, standard setting ethics, norms, actually organizing information, as you put it, to actually be able to be used at scale by different organizations. But I think the biggest one, honestly, is just capital. And I think that there is a desire, and there is lots of large opportunities, particularly in narrow AI solutions, to begin making massive impact in global health. But it's going to take and require real money. It's not going to be done with 500K grants or $1 million grants or even $10 million grants. This is going to require real capital, just like developing new drugs. You're going to have to
find that.
Like hundreds of millions of billions of dollars, right? I mean, you're going.
Okay.
Yeah. Well, I think that it's easy to look at a software problem and say, oh, well, that's just like building a new website, right? That's nothing like what AI is like. The level of technical expertise that's required, the number of professionals that's required who have incredible training and are paid enormous sums of money, is such that you have to have real capital behind these problems, or you're not going to be able to develop tractable solutions.
Okay, I'm bringing all of the rest of you into this conversation in 2 minutes. Do you just want to give 1 minute apiece? Do you have anything to add to this?
Just very
or
quickly.
informed optimism?
So I totally agree in terms of how to move forward collectively. And as Jay said, and as you mentioned, the idea is how to bring together people from different areas, donors, innovators, people who understand scaling, government, etc. So
I have promised this young man on the front row. First
yes.
up, do you still have a question?
Yes.
You look awfully cool with those blue shades on.
Thank you, thank
Say
you.
your name and where you're from.
Well, my name is Neillan Baptiste, and I'm from Brooklyn, New York. I run my own media company with my brother Shaden, who happens to be right behind me, second in that row. It's called the Art and Lorena Hornson Network. But the question I wanted to ask is, AI happens to collect a lot of information on people. It's a very important aspect of its usage and its deployment in the world. And I think this, I honestly think this could pave the way for exploitation, because as companies collect more and more data about users, there is obviously, with the Facebook controversy and other related incidents, there's been the consumers are not getting the control that they deserve over their information. I mean, for example, I'm pretty sure that most of the people in here have a cell phone or an iPhone on them, and I've noticed that they pull them out almost like 3 times every 10 minutes or so. And while this might not sound important, Apple has an entire team of psychologists, people who are investigating the human mind, so that we do this, and it's really to drive profit. So I think it should. So what I want to ask, really, the point of the question I'm getting down to is, how do in collecting people's data, not just in sub-Saharan Africa, but in general, to advance healthcare with AI, how do people prevent being exploited from that, really?
Excellent question.
How do people get control over their information,
So data ownership and data control. What I'm going to do, and I should have stated this to the beginning, I'm going to take a couple of questions so that we maximize our opportunity for questions here, and then our panelists will sort of tackle each one. So we will hold that thought. Rachel, you running to the hand? Oh, sorry, we have another one over here. Yes.
Hi, I'm Richard Stanley. I work at IntraHealth International, and we work quite a lot on FHIR and other interoperability standards. And I guess my question is just to understand, especially from the Avalon experience, and how do you manage this kind of gap between having all the data center capacity generally outside of Rwanda, for example, and having to deal with data privacy, so data localization? Can you have some data that crosses borders? things like that. I hope that's clear.
Okay, yes, and,
Yeah, thank you. My name is Leopoldo Villegas, working with Global Development One. I'm from the implementation side. I really appreciate because this meeting is terrific. So, 15 years ago, we started using collective intelligence. We got a group of guys, the best minds, say, okay, we want to eliminate malaria in a country. We developed a proof of concept. We implemented. We got a country, like Sunil mentioned, people who wanted to do it from all the levels, from Minister of Health down to the locals. The work was done. The country is already in the elimination list, so the work can be done. So I think really the message or the lesson learned is we have those countries. And what we need here is just a little bit push from the donor communities, because we can have the scenario, and this model can be replicated in tuberculosis, can be done in HIV. It's epidemiology, data-driven, and honored by the countries. The countries running the whole show, and they have done that. The only thing that we invest is that we invest 5 years with organizing all the model for elimination, and this is targeting implementation and targeting where to invest the best strategies, using evidence, the same data from the country. And now, of course, everybody's famous, the ministers and everybody in the country. So after the work was done, they took over and they are just preparing for elimination. So I really appreciate all the input for the panel. Thank you.
excellent. Why don't we start with those first three, and then we'll come to the middle. I see a number of hands, so we'll be ready for you in the next round. So we have a very astute question around the data ownership, a question I think directed for you around gap between data capacity and data privacy and data localization, and then any other comments on using data for better decision making, and certainly lots of lessons to be learned around malaria elimination. So who wants to dive in?
Yeah, one minor comment I'll make just to start is that one of the ways that we've helped solve this with other problems on the internet is by having open systems, right? And so I think having open protocols, which the internet was built upon, having open content projects like Wikipedia, these are all things that help solve some of the problems that you're describing. And I think that when that doesn't happen, so Facebook is a good example recently, when there are no checks and balances, no open stakeholders to kind of serve as a check and balance on the private company stakeholders, that becomes an issue because then there are no credible alternatives to turn to. And I think that having multiple solutions that are private companies that are successful, but then also open standards, are really important. The thing that I'll agree with you on that I think is super important is that everything else will look small compared to this in the balance of time. This will be much more profound than any invention that humankind has ever created. And really a lot of the technologies that are being developed now are really lead-ups to the main event, and the main event is AI. And I think that compared to social networks, compared to the internet when it was in its infancy, compared to the printing press, they're all going to be small compared to the idea of scaling the thing which makes us fundamentally human, which is intelligence. And I think you're making an incredibly important point. It's the thing that we have to be most concerned about is how do we build these systems in ways that don't exploit everyday people.
Yeah. I also wanted to add one other thing.
Super quick point with the mic.
Yes, thank you, man. Thank you. I'll try and make it a little brief. But I also wanted to say that a big part of your approach to AI is government cooperation, cooperating with governments and the countries leading the effort in healthcare. And while I do agree that's very important, governments as well as companies also have the potential to severely exploit their citizens. I feel that even though, and it is in history, it's been proven time and time and again that when something is promised for the benefit of all mankind, there are still parts of mankind, very considerable parts, who do not benefit, and that is usually the minority. So I also think governments have a role to play in this, whether it's a positive role or a negative role. And so I want to ask, also to add my point, how can you prevent countries like, for example, the Philippines or China from weaponizing AI against, for example, their opponents or political dissidents or just simply people who don't agree with them? Because it's very important.
Did you say that you and your brother actually you're entrepreneurs? You have a company you're starting?
Yeah, we have our own media company. It's called RH and the Reno Hornson Network.
Very impressive. All right. Well, so you threw the big bombshell out there, and we also have a question for Babylon. So one of you want to address that point, and then we'll take the Babylon question.
So, first of all, that point is really well taken, probably by, I think, everybody here. In general, I would say that technology is this force multiplier. And what that tends to mean is that those who adopt it first, people who are wealthier, people who have more resources in general, get to use it, and it becomes more of a divide between the haves and the have-nots, whether that's have money or have technology or have AI. Or
it's to increase power, you know.
No, exactly. I don't think there's a very easy way for us to, control what China does with a new technology. I do think that there are models out there for empowering consumers, empowering citizens, empowering individuals with their data. And I think the example that springs to mind is the General Data Protection Regulation in Europe. I think it's a fantastic model. I wish more countries and regions would take that model and learn from it. At the same time, it's also very challenging because a lot of the geographies where development communities are working, there may not be that capacity, that same capacity for regulation, right? It's competing with a whole lot of other priorities that the governments have. But I think that's a great model, and I think that's the first step, is to look at that and see which pieces of that can we, as we work with our host country partners or as a development community, push for. Which pieces can we borrow and push for?
I have a one-word answer to both questions.
One word, perfect.
Which is transparency. I think we need to make sure, this is a question that we're not going to answer here today. It's a question that needs to continue to be asked. And we need people who are going to be the advocates of the consumer, of the citizen, asking these questions not only of the development partners and the innovators and the countries where these solutions are being adopted, but of other actors as well. And we need that transparency in the business model context as well to understand how data that's collected is going to be used.
Clearly, the upcoming generation is going to force all of us to be held accountable there. Babylon question.
Just quickly to this point, I think that was fantastic. The questions which you raised were fantastic. They apply not just to AI, but also, more broadly on the internet, social networks, etc. So those are things which I've been thinking about quite a lot, and I think GDPR is a really kind of nice intermediate solution. I've often heard of it referred to as good data practice rules. That's not actually what the acronym stands for, but it's actually true. If you just apply good data practice rules, then we'll be in a good position. And that's where I think actually where agencies and donors can help to enforce those standards. To the Avalon question, it was about. Can we just repeat that question?
Yeah, it was talking about the gap between data capacity and data privacy and data localization.
Yeah, so all of the data which we have on our users or our patients in Rwanda or in Southeast Asia or in the UK stays within that country. We do employ those standards, but those standards are very much to do with knowledge, independent of data. So I'm not sure if that answers the question, but the data stays within the country.
Do patients have access to that data?
Sorry, I'm going to, let me, just want to get a whole bunch of other questions.
Oh, sure, sorry. Yeah.
You can give a yes or no answer to that while the mic comes to the hands that are up.
Hi. Go ahead, sorry.
Go ahead.
Hi, I'm Jessica Taft. I work at the National Institute of Allergy and Infectious Diseases on a tuberculosis data sharing and analytics program. Thank you all for a really fantastic discussion and overview of this topic on AI and global health. But what I find that's been missing from this topic has been the role of AI in science, and particularly in research, and the role of this sector in defining the collective path forward. Of course, I'm a little biased, being a scientist myself. But biomedical science is creating tons and tons of data that can be mined out there. And that can be directly applied to health and in developing solutions and technologies. And I'm just wondering, I didn't really see it in the slides in the report. I haven't yet to go through the report, but I'm wondering how we can bring the science community into this, and particularly use us, the research and development to collaborate better with development and global health communities.
I'll just say on that point that it's an excellent point, and I think you'll find some tables in the document, in the report that mention that, and I think the group that worked on it consciously set that one aside, but it's not because it's not important, it was just to narrow in. But I'm really glad you brought that up. Let's get a few more questions out there. So over here, first, yes.
Hi, Carly Krugner from the Center for Global Development and the Hopkins Bioethics Institute. So a few of you mentioned issues with data bias, and I wondered, given that we know that our existing clinical evidence base is extremely biased in favor of the typical patient being the white middle-aged male, and there's tremendous issues with gender, with racial minorities, etc., how are you in the current applications trying to address some of the existing biases in the data that you're getting? And then thinking forward, how do you actually think about standards to address existing data gaps? What are the opportunities for learning healthcare systems and real-world evidence to try and address those gaps, and just trying to avoid embedding and amplifying a lot of the algorithms that might actually reinforce health inequities?
Great. All right, where's that? Here?
Yeah, hi, Vincent Huang from the Circle Foundation. We're looking at see how AI can be used as a complementary methodology to develop a more holistic approach to different problems. My question for the panel is that I think in general, we as a development community has been consumer of technologies. And let's not forget, like AI is actually extremely immature, right? I mean, really blew up like since 2012, and that hasn't been that many years. And if you go into one of the more theoretical conferences, the researcher will tell you, we don't even know how to evaluate this method properly. There is a problem with accountability, there's a problem about transparency, there's a problem about even replicating the simulation I just did yesterday. So I think with that in mind, in terms of like just taking this technology as it is as a solution to solve our problems, I wonder how can we as a development community to actually be at that very beginning of this development in AI and have a real say in terms of what kind of solutions being developed, what kind of directions, and some of the issues that we see in development work that are also common across various different side of sciences. How do we actually trying to be involved in that conversation right from the beginning?
Great. I'm going to get two more questions on the table. Please make them super, super short. Where are the mics here? Right back here.
Requires such large amounts of dollars and such large amounts of training and model development and everything else that to cross the threshold really need to have it happen. You can show where do I find but even that costs technology. And then
excuse me, sir.
oh yeah, no worries.
By the way, you didn't answer my question earlier.
I'll answer it. Let me just.
Yes.
Have you ever tried to do this quickly?
Yeah, so I just straight meetings from it.
Yes.
Hi, Carly. Small part of
I've got some book recommendations if you're open to it. What are you reading?
What am I reading right now?
Yeah.
Well,
on AI.
On AI?
Yeah, are you reading anything on AI?
Not at the moment. I have, I do read Time magazine and Bloomberg, and I do read some big books on it.
Life 3.0.
Life 3.0.
Yeah.
I've read. I think it was Super Intelligence.
Yeah.
Yeah. The book
Nick
Super
Bostrom.
Yes. Of course. It's a very good book.
It's very good. This is almost like a follow-up to that.
Yeah.
Max Tegmark is a physicist, but he's also a renowned practitioner of AI himself. He's at MIT.
Yeah.
He's great. Have a read of that.
Yeah, but you did not answer my question earlier.
The question was about, do patients have access to the data?
Yes.
They do. Well, currently we're implementing a feature into the product which ensures that they do. So, yeah.
Oh, thank you so much.
It's a great question.
Thank you.
Yeah.
Would you like my business card, sir?
I would love your business card. I just actually said to your dad that if you're in London, you should come and have a tour of Babylon. I'd love to kind of show you around.
Oh, thank you, sir.
Yeah, of course.